Hello everyone, I am Wilhelm, PhD student at the Amsterdam UMC. In this short video, I would like to give you a brief insight into my research. In this image, you can see the aorta of a healthy person. That's the main blood vessel carrying blood away from the heart. However, in some patients, the aorta unfortunately expands like a balloon, which is then called aneurysm. The aneurysm can get larger and larger and ultimately rupture, which results in high motility rates. So basically, these patients have a ticking time bomb in their body. In my research project, I focus on this so-called abdominal aortic aneurysms. To prevent rupture, physicians can perform surgery. Surgery is performed when the aneurysm has reached a certain size. Both the patients shown here have a similar sized aneurysm and would therefore both get surgery. As both have way different bodies, a more patient-depending measurement than just the size of the aneurysm would be beneficial. For instance, a measurement of the characteristics of the aortic wall. That's where my research in MRI comes into place. With MRI, we can make different types of images of the human body. Here you can see an example image of a healthy volunteer. The aorta is within the red box. We can also change the settings of the MRI scanner so that the blood appears dark instead of bright, as shown here. Then we can also see the aortic wall nicely. But why is that useful? Well, first of all, think about an infrared camera. The colors represent the temperature. That you could use to estimate if the person on the image has fever or not. In the MRI, we can make images with different settings, then do some mathematical modeling, and then calculate so-called T1 and T2 maps of the aortic wall. These T1 and T2 maps might give us some insights into the tissue characteristics and might correlate with the risk of rupture. So, to sum up, in our study, we want to connect the measured T1 and T2 values of the aortic wall of several patients with their aneurysm growth over time and ultimately have a better risk assessment factor than just the size of the aneurysm. Thank you for listening.